Let me tell you something you might find surprising, my friend. Did you know your eyes can do more than just help you see the world around you? They can actually reveal hidden health issues that might be quietly developing inside your body. So I hope you'll stay with me as we uncover what your eyes might be trying to tell you about your health. Sometimes before you even feel anything is wrong. It's wonderful to have you here today. In this conversation, I'd like to walk you through 10 surprising health issues that an eye exam can detect. You'll see why looking after your eyes is about so much more than just keeping your vision clear. It could truly be a lifesaver. Most folks think of eye exams as just a way to check if they need new glasses. But here's something important. Your eyes are actually a window into your overall health. Many serious conditions, things like diabetes, high blood pressure, or even autoimmune diseases, can show their very first signs in your eyes. Sadly, these early clues are often missed, and that can mean a late diagnosis and tougher treatments down the road. By learning what to watch for, you can catch these issues early and give yourself the best chance to stay healthy and strong. Let me sit with you a moment and share something important about how our eyes can quietly tell us about hidden health issues, sometimes even before we feel sick or notice anything wrong. Over the years, I've learned that our eyes really are windows to our health, and I want to walk you through some of the things they can reveal, especially for folks in our golden years. Let me start with diabetes, because it's something that can sneak up on you. You might feel fine, but diabetes can start to damage your eyes before you even know you have it. When your blood sugar stays high for a long time, it can harm the tiny blood vessels at the back of your eye, in a part called the retina. This is called diabetic retinopathy. You may not notice a thing at first because the changes happen slowly and don't always cause symptoms right away. As the damage gets worse, you might start to notice blurry vision, or that your glasses prescription keeps changing. You might have trouble seeing at night or see floaters, those little spots or strings that drift across your vision. Some people notice that colors seem faded, or they have dark or empty spots in their vision. If there's bleeding inside the eye, you could even lose part of your sight suddenly. What's happening is that high blood sugar makes the blood vessels in your eye bulge and leak fluid or blood, causing swelling and damage. Over time, some of these vessels may close off, and parts of the retina stop getting enough oxygen. The eye tries to fix this by growing new blood vessels, but these are weak and can bleed easily, leading to more serious problems like scarring, the retina pulling away from the back of the eye, retinal detachment, or even glaucoma. One particularly serious problem is diabetic macular edema, which happens when fluid leaks into the center part of your retina, the macula, the area you need for sharp, clear vision. This can make your vision much worse. If these problems aren't found and treated early, they can lead to permanent vision loss or even blindness. The good news is that an eye doctor can often see signs of diabetic retinopathy during a regular eye exam, even before you have any symptoms of diabetes. That's why it's so important for people with diabetes or those at risk to have regular, thorough eye exams with their eyes dilated. Finding problems early gives you the best chance to protect your vision. High blood pressure or hypertension is another quiet troublemaker that can harm your eyes without you even knowing it. When your blood pressure stays high for a long time, it puts extra strain on the tiny blood vessels in your retina. The retina is important because it helps you see by sending images to your brain. At first, you might not notice any problems because this damage usually happens slowly and doesn't cause pain or obvious symptoms. But as it gets worse, you might start to have blurry or dim vision, see dark spots or floaters, or even have headaches. Sometimes you may notice a small bleed in the white part of your eye, called a subconjunctival hemorrhage, which looks like a red spot. These signs can show up before you feel any other effects of high blood pressure. Sometimes high blood pressure can also cause the blood vessels in your eye to become narrow, twisted, or even leak blood or fluid. If this happens, it can lead to more serious problems like swelling in the center of your retina, the macula, damage to the nerve that connects your eye to your brain, the optic nerve, or even sudden vision loss if a blood vessel gets blocked or bursts. An eye doctor can spot these changes during a regular eye exam, often before you have any vision problems or know you have high blood pressure. This is why it's so important to have your eyes checked regularly, especially if you have high blood pressure or are at risk. Catching these changes early can help protect your vision and your overall health. Keeping your blood pressure under control with medicine, a healthy diet, and regular exercise is the best way to prevent these eye problems. You know, as we get older, it's easy to brush off little changes in our appearance. Maybe you've looked in the mirror and noticed a faint bluish or grayish ring around the colored part of your eye. That ring, called arcus senilis, is actually quite common in older folks, and for most of us, it's nothing to worry about. It's just a sign that we've gathered a bit of wisdom and maybe a few more birthdays along the way. But here's something important. If you ever see that ring in someone much younger, it could be a sign their cholesterol is running high. For them, it's worth getting checked out, because high cholesterol can quietly cause trouble for the heart and blood vessels. For us, though, it's usually just a harmless sign of age. Now, have you ever noticed soft, yellowish bumps or patches on your eyelids, especially near the inner corners? They're called xanthelasma. They don't hurt and won't affect your vision, but they're made up of cholesterol deposits under the skin. Sometimes people feel self-conscious about how they look, but doctors can remove them if they bother you. More importantly, these little bumps are like a gentle nudge from your body, reminding you to keep an eye on your cholesterol and heart health. But sometimes high cholesterol can be sneaky and more serious. It can build up inside the tiny blood vessels of your eye. If a piece of this fatty plaque breaks loose and blocks a vessel in your retina, it can cause sudden vision loss, almost like a stroke in the eye. If that ever happens, it's an emergency, and you should see a doctor right away. So if you notice a ring around your cornea or yellow bumps on your eyelids, don't ignore them. They might seem harmless, but they could be your body's way of whispering that it's time for a checkup. Getting your cholesterol tested and keeping it under control can help protect both your eyes and your heart. Our bodies have a way of speaking to us, even if it's just a quiet whisper in the mirror. Listening to those little signs can help us stay healthy and keep enjoying all the beautiful things there are to see in this world. The fifth hidden issue is jaundice or liver disease. Jaundice itself is not a disease, but a warning sign that something is wrong with your liver, gallbladder, or the tubes, bile ducts, that carry bile from your liver to your intestines. Common causes include liver infections, like hepatitis, liver damage from alcohol or certain medicines, gallstones, or even cancer. Other symptoms that may come with jaundice are dark urine, pale or clay-colored stools, and itching. A yellowish color in the whites of your eyes is often an early sign of jaundice, which usually means there is a problem with your liver. The liver is an important organ that helps clean your blood and get rid of waste. When the liver isn't working properly, a yellow substance called bilirubin builds up in your blood instead of being removed. This extra bilirubin causes the yellowing of your eyes and sometimes your skin as well. The yellowing of the eyes, known as scleral icterus, often appears before the yellowing of the skin, making it one of the first things you or your doctor might notice. If you see this yellow color in your eyes, it's important to see a doctor right away. Jaundice can be a sign of a serious health problem that needs quick attention and treatment. The sixth hidden issue is thyroid disease. Thyroid disease, especially a condition called Graves' disease, can cause noticeable changes in your eyes. The most common sign is that your eyes may start to bulge or stick out more than usual. This happens because the tissues and muscles around your eyes become swollen and inflamed due to your immune system mistakenly attacking them. You might also notice that your eyelids pull back, making your eyes look bigger and more open. Sometimes your eyelids may not close all the way, which can make your eyes feel dry, gritty, or irritated. Other symptoms include red or puffy eyelids, watery or very dry eyes, and trouble moving your eyes. Some people may see double or have pain or pressure around their eyes, especially when looking in different directions. These eye changes can happen in one or both eyes, and they are often easy for both you and your doctor to notice. In most cases, these symptoms last for a year or two and may get better on their own, but sometimes the changes can be long-lasting or even permanent if there is scarring or damage. In rare cases, the swelling can press on the nerve that connects your eye to your brain, which can lead to vision loss if not treated quickly. It's important to know that these eye problems can happen even if your thyroid hormone levels are normal, and not everyone with thyroid disease will have eye symptoms. If you or your family notice that your eyes look different, feel uncomfortable, or your vision changes, you should see your doctor or an eye specialist. Early treatment can help prevent serious problems and protect your eyesight. The seventh hidden issue is multiple sclerosis. Multiple sclerosis, or MS, is a disease that affects the nerves in your body, including the ones that help you see. One of the first signs that someone might have MS can be problems with their eyes or vision. For example, you might suddenly notice that your vision in one eye is blurry or that you can't see as clearly as before. Sometimes you may see double, meaning you see two images of one object instead of one. Another common sign is pain when you move your eyes, especially if you look from side to side. These symptoms can come on quickly and may be quite worrying. The reason this happens is that MS causes the body's immune system to attack the protective covering around the nerves, called myelin. When this covering is damaged, the nerves can't send signals properly, including the ones that go from your eyes to your brain. This can lead to blurry or lost vision, usually in one eye at a time, pain when moving the eyes, double vision, trouble seeing colors which may look faded or washed out, uncontrolled eye movements where the eyes flick back and forth on their own, called nystagmus. These eye problems can be the very first sign of MS for some people, even before they notice other symptoms like numbness, weakness, or trouble walking. Sometimes the vision problems get better on their own after a few weeks, but it's very important to see a doctor right away if you notice sudden changes in your vision. Remember, having these symptoms doesn't always mean you have MS, as other conditions can cause similar problems. But if you do notice sudden vision loss, double vision, or pain with eye movement, it's best to get checked by a doctor as soon as possible. The eighth hidden issue is autoimmune diseases. Autoimmune diseases like lupus and rheumatoid arthritis can cause your immune system, which usually protects you, to mistakenly attack healthy parts of your body, including your eyes. This can lead to ongoing problems such as redness, dryness, and irritation in your eyes. For example, you might notice that your eyes feel dry, itchy, or as if there's sand in them. They might look red, burn, or be more sensitive to light. Sometimes your vision might get blurry, or you might feel like your eyes are tired and uncomfortable by the end of the day. These symptoms can come and go, or they might stick around for a long time if the autoimmune disease isn't controlled. One common problem is called dry eye syndrome. This happens because the glands that make tears are attacked, so your eyes don't get enough moisture. You may also develop rashes around your eyelids, or even more serious issues like inflammation of the white part of your eye, anoscleritis, which can be painful and, if not treated, could affect your vision. In rare cases, these diseases can cause swelling or damage in deeper parts of the eye, like the retina or optic nerve, which can lead to vision loss if not treated. That's why it's important to pay attention to changes in your eyes and see an eye doctor regularly, especially if you have an autoimmune disease. Early treatment can help prevent serious problems and keep your eyes healthy. The ninth hidden issue is allergies. Allergies can make your eyes feel very uncomfortable. If you have allergies, you might notice that your eyes are often itchy, watery, red, or swollen. Sometimes it feels like there's sand or dirt in your eyes, and your eyelids may look puffy especially in the morning. These symptoms happen because your body's reacting to something harmless, like pollen, dust, pet hair, or mold. When these things get into your eyes, your body tries to fight them off by releasing a chemical called histamine. This causes your eyes to become red, itchy, and watery. Eye allergies are not contagious, so you can't catch them from someone else. They often come along with other allergy symptoms, like a runny or itchy nose and sneezing. Some people may also have a scratchy throat or even a headache. While eye allergies are usually not dangerous, they can make it hard to read, watch TV, or enjoy your day. If your symptoms are very bothersome or last a long time, you may need medicine to help you feel better. Over-the-counter eye drops, antihistamines, or prescription treatments from your doctor can help reduce the itching and swelling. The best way to prevent eye allergies is to avoid things that trigger them. Try to keep windows closed during high pollen seasons, use air conditioning, wash your hands after touching pets, and don't rub your eyes. If you still have problems, talk to your doctor or pharmacist about the best treatment for you. The 10th hidden issue is tumors or cancer. Sometimes serious health problems like tumors or cancer can show up in your eyes, and it's important to know what to look for. Although eye cancer is rare, it can cause changes that you or your eye doctor might notice, often before you feel any pain. One of the main warning signs is a sudden change in your vision. This could be blurry eyesight, losing part or all of your vision, or seeing shadows, flashes of light, or wiggly lines that weren't there before. You might also notice floaters, little spots or squiggly lines drifting across your view. Another sign is a change in your pupil, which is the black circle in the middle of your eye. The pupil might look a different size or shape than usual, or you could see a dark spot on the colored part of your eye, the iris, that seems to be getting bigger. Sometimes your eye might look like it's bulging, or it may not move properly. You might even find a lump on your eyelid or around your eye that keeps growing. Most of the time, eye cancer doesn't cause pain unless it has spread or is pressing on other parts of the eye. In many cases, these changes are found during a routine eye exam before you notice anything is wrong. It's also possible for cancer from other parts of the body, like the lungs or breasts, to spread to the eye. That's why any sudden or unexplained changes in your eyes, like vision loss, changes in the size or color of your pupil, or a new lump, should be checked by a doctor right away to rule out serious problems. While these symptoms can be caused by other, less serious eye conditions, it's always safest to get them checked early. Early detection gives you the best chance for successful treatment if it is something serious. So my dear friend, our eyes can quietly warn us about many hidden health issues. Regular eye exams are one of the best ways to catch these problems early, often before you notice anything yourself. If you ever notice changes in your vision, new spots, colors looking different, or anything unusual, don't wait. Let your doctor know. It's one of the best ways to keep both your eyes and your whole body healthy as you enjoy your years ahead. And remember, I'm always here if you want to talk more about how to take care of your health. Let me share something with you, my friend, as we sit together and talk about the importance of keeping an eye on our health. Quite literally, you see, regular eye exams aren't just about making sure you can read the newspaper or enjoy your favorite TV shows. They're actually one of the best ways to catch hidden health problems early, often before you notice any other symptoms at all. If you ever spot changes in your eyes or vision, maybe things look blurry, you see double, or your eyes just don't feel right, please don't hesitate to let your doctor know. It's always better to be safe and get things checked out. Now, before we go on, if you're finding this information useful, I'd encourage you to hit that subscribe button and turn on notifications. Just like those young folks say on the internet, there's so much more to learn about protecting your health, and you won't want to miss out on helpful tips that could make a real difference in your life. Here's something truly surprising, and perhaps the most important thing I can tell you today. Sometimes the very first sign of a serious health issue, like multiple sclerosis or a thyroid disorder, shows up in your eyes even before you feel anything else in your body. For example, with multiple sclerosis, you might notice sudden vision loss, double vision, or pain when you move your eyes. These can be early warning signs long before other symptoms appear. Thyroid problems, too, can cause changes like bulging eyes or your eyelids pulling back. Often, these things are only picked up during a routine eye exam. Many times, people don't even realize something's wrong until their eye doctor spots it, which is why those regular checkups are so important. Not just for keeping your vision sharp, but for protecting your overall health and well-being. So to sum it all up, your eyes are much more than just windows to your soul. They're powerful indicators of what's happening inside your body. By paying attention to changes in your eyes and making regular eye exams a priority, you're giving yourself the best chance to catch health problems early, get the right treatment, and stay healthy for years to come. If you found this helpful, I hope you'll look into our other health-related videos and articles for even more valuable advice. And please don't be shy. Share your own experiences or questions in the comments below. We love hearing from you and building a community where everyone can learn and support each other on the journey to better health.